Just know my hand gonna come to a decision of it. Sooner or later, you may give way hit the ground. Save it for later, don't run away and let me down. Sooner or later, you hit the deck, you get fall down. Save it for later, don't run away and let me down. Okay, and that's the English Beat with Save It for Later. Chose that song because we're talking about behavior, right? And part of our behavior and part of the important part of our behavior is our ability to make decisions and to recognize that, the decisions that we make now have an impact on our future, right? So that song, is about save it for later, and sooner or later and all that kind of stuff. Yeah, but boy, if you weren't around when that song was popping, I'm sorry you missed it. I don't get the music these days. I love rap and all that other stuff, but boy, I think the music from the 80s and the 90s was really suits me the best. Okay, so we're talking about the brain and nervous system. Let's look at an overview. All right, in this lecture, we're going to talk about the structure of the central nervous system. We're going to do a quick video on Phineas Gage and why he's important. We've got the cerebral hemispheres to talk about, difference between white and gray matter. We'll talk about the brain divisions and some neuroanatomy nomenclature, and then we'll wrap it up with the lobes of the brain and another little activity to help get that stuff um, to have that stuff sink into your brain. Yeah. Okay, so let's take a look at the structure of the central nervous system. So remember, we're talking about just the brain and spinal cord now, right? And so, as your textbook notes, the major divisions here are five. We've got the telencephalon, diencephalon, mesencephalon, metencephalon, and myelencephalon. Yeah. Now, none of these words, you probably never heard any of these words before. They're all Latin. Yeah. And, you're probably never going to use these words again. Maybe, maybe not. I don't know. But it's important to understand sort of where these came from, where these terms came from, and why we still use them in our medical neuroanatomy nomenclature. Yeah. So let's move forward and start working on that. So again, remember, we're talking today about the brain and spinal cord, the central nervous system. Yeah, the central nervous system is the center of all of our behavior. It is the source of our consciousness. It is what allows us to have memory, to experience emotion, to have sensory experience. Everything that we do and are and see and feel, and everything that we will be is based on this central nervous system. Yeah. And so the easiest obvious division in the central nervous system is the brain and the spinal cord. The brain sits on top of the spinal cord. The spinal cord is a communication pathway between the brain and the body, right? So, some folks, I've had students before tell me, so we're kind of like these, like these mechs, what was that movie, Pacific Rim? And, they have a lot of Mobile Suit Gundam and all kinds of like anime characters and things like that, with the idea being that there's a human being inside of a giant machine, a giant robot. Yeah. And the human being makes that giant machine fight and run and walk and do everything that it does. And they sort of say, so it's kind of like, we're kind of like mechs in that way, right? The body is just machinery. Yeah. And the brain is where all the important stuff happens. Yeah. So how does it do that? Well, the spinal cord is what allows us to communicate with the rest of our body. Yeah, and it brings information in from the body, and it also sends the motor commands to allow our motor functions as well as our autonomic functions, right? We don't have to think about breathing, unless of course we get caught under by a wave or something like that. We have to hold our breath or whatever, but we don't typically think about, okay, draw a breath in, let the breath out, draw a breath in. Yeah, that's autonomic. that's automatic. It happens without our thinking, which is good, because if it didn't, we'd never be able to sleep, right? The minute we'd fall asleep, we'd stop breathing. Yeah. Same thing goes with a whole bunch of other processes, and we'll talk about those as we go. But let me introduce you real quick to a gentleman named Phineas Gage. You may have heard about Phineas Gage from Psychology 100 or some other classes, maybe from cognitive psychology or that sort of thing. We're going to do a quick look at him for several different reasons. One of those is that, the earliest ways of studying the brain, they had two different things they could do, right? You couldn't hit somebody with a hammer and pry the top of their skull off and poke at it and ask people what they felt and stuff, right? That's unethical. The person could die, all that kind of stuff. So our options typically were to observe people with behavior that did not match everybody else's behavior. For example, maybe someone who struggled with speech, yeah, and to sort of really describe that struggle that person was having. What was the problem? Was it with words that began with the letter C? Was it, were they having a hard time understanding speech? Were they having a hard time producing speech? Were they having a hard time with written speech or with language or all that kind of stuff, right? So they pay very close attention to the problems that the person had, and then ask them, when you pass away, will you allow me to do an autopsy? Will you allow me to examine your brain to see if I can find some areas that might correlate to the problems that you had? And so that was, folks like Pierre-Paul Broca, Wernicke. We're going to talk about those folks, with that idea being that, because they didn't have MRI machines back in the 1800s, right? So we had to basically either observe people's behavior and then look at their brains afterwards, or sometimes we would get lucky. The psychologist, the anatomist would get lucky. The person wouldn't. But there would be someone would get injured, like Phineas Gage did, right? And so a lot of the major advancements that psychology and that neuroanatomy had in the 1800s and the early 1900s were based on things like war. Yeah, anatomists would go to surgical units on the battlefield where they'd be bringing in people who had open head wounds. Yeah, who were still alive, and because they were still alive, they could ask them, "Would you mind? Can I do this? Whatever." Horrible situation to be in, right? But the idea being that, hey, this might be your last 2 hours on the planet, and you can contribute to our medical knowledge and such if you allow us to, basically poke at your brain with a stick and then tell us what happens. Yeah. Okay. So that's one of the reasons why we care so much about Phineas Gage. Phineas Gage experienced a traumatic brain injury that 999 times out of 1,000 would lead to automatic, immediate death. Yeah. So, but it did not for him, right? Okay, so we've got a video here that I want us to watch. It's about 4 or 5 minutes long, and then after that, we'll talk a little bit about why that was important.
In the grand scheme of things, there aren't many ordinary people who have names remembered by history, unless, that is, something extraordinary happens to them. The extraordinary certainly happened to Phineas Gage on September 13, 1848. Unfortunately for Gage, that extraordinary thing was pretty gruesome. Here's why Phineas Gage is still fascinating, even today. What happened? 25-year-old construction foreman Phineas Gage was helping cut a new railway bed through Cavendish, Vermont, and was using a tamping iron to pack explosives into a hole. And then, this happened. The explosives detonated early and sent the 4-foot, 13-pound tamping iron through his left cheek, into his brain, and out his skull. Making things worse, according to legend, he might not have even lost consciousness. Historical documents say that he was driven into town where he sat on a porch chair and chatted to passers-by as he waited for Dr. John Harlow. After a few days, he developed a brain infection that left him even closer to the Grim Reaper's door. But the Reaper had apparently been impressed enough with what he'd already survived to give him a pass. He recovered, lost use of his left eye, and went home 2 months later. Everyone who knew him before and after the accident agreed he had changed, and when he died in 1860 after suffering a series of seizures, he remained a part of historical and medical infamy. Pioneering neurology. Gage is one of the earliest documented cases of traumatic brain injury, and his accident couldn't have come at a better time for the science of neurology. When Dr. Harlow first documented Gage's story in the Boston Medical and Surgical Journal in 1848, no one believed it. It wasn't until 1850 when Harvard professor Henry J. Bigelow wrote a piece on him being a fully functional human post-accident that people started to notice this medical miracle. Bigelow's follow-up report in 1868 focused on the mental manifestations of the accident, saying he had become fitful, irreverent, indulging at times in the grossest profanity, and manifesting but little deference for his fellows. In short, the guy who got a giant metal spike through his head allegedly became a jerk. Neurologists at the time insisted that we needed to look inside the brain to unlock the secrets of what made us human, and Gage was the first documented case that provided evidence for this. So we should probably be thanking Gage for his unwitting scientific contributions. Insane in the brain. There's still a ton we don't know about brain function today, and we can't always peek inside to see what's going on, so we have to find other ways to get a look. Gage's accident and his big open brain was helpful in doing just that. We know what part of his brain sustained the most damage, the prefrontal cortex, and we know what happened to him afterward. His memory was intact, and he was perfectly capable of working, traveling, and doing everything else a responsible human should do. But everyone also agreed that his personality underwent a big change, which was pretty good proof that our personality lives in our prefrontal cortex. While some sources say post-accident Gage was a depraved monster,
I'm still the same man. You're the same man! Look at yourself, Phineas! Give me my job back! You give me my job back!
other documentation shows he managed to maintain a pretty normal life. It is also written that he exhibited himself in freak shows, and that he had no more social inhibitions, was a perpetual drunk, and even that he was described as psychopathic.
He's like an animal now.
An animal's emotions in a man's body.
But there's nothing in Dr. Harlow's writings that suggests anything of the sort, and his mother testified he was eager to keep working after the accident and loved making up stories to tell his nieces and nephews. Psychopath, storyteller, or something in between? No one's entirely sure. New insight. Technology has come a long way since Gage's accident, and it's a lucky thing that we still have his skull. The official cause of Gage's 1860 death was complications from epileptic convulsions. No autopsy was performed after he died, but Gage's body was exhumed 7 years after his burial, and his brother-in-law took both the skull and tamping iron to Dr. Harlow. Today, both artifacts are housed in Harvard's Warren Anatomical Museum. We don't have any direct information about Gage's brain, but we do have two of the most important tools needed to recreate what happened to him. His skull was mapped and diagrammed as early as the 1940s, according to NPR. And as technology has improved, we've gotten increasingly better looks. In 2012, researchers from the Laboratory of Neuroimaging used a combination of techniques to map exactly what connections were severed when the tamping iron sliced through his skull. And they found something pretty interesting. The white matter in Gage's brain likely sustained damage less severe than you might expect, similar to the damage done by a typical brain lesion. Pretty lucky for such a seemingly unlucky guy. We can overcome. There's a lot of gory stuff that's involved in talking about Phineas Gage. He's still the poster child doctors point to when they want to show patients and their families what the human body and brain can overcome, even without the miracle of modern medicine. If there's one good thing to come out of Gage's insane, life-changing accident, we think he'd be happy to be an inspiration to people going through similar life-altering traumas, which is pretty fascinating.
Okay.
In the
All right, so that's a real quick look at Phineas Gage, right? Why do we care? Well, because again, here's a gentleman who survived a severe head trauma, right? And we know where the trauma was. The trauma was to the frontal lobe of his brain, yeah? And then we also know, then we have descriptions of how his behavior changed, right? So his memory didn't change. He can remember passing and past events correctly, yeah, before the injury, right? They say, this is Dr. Harlow, he said his intellectual manifestations were feeble. being exceedingly capricious and childish, but with a will as indomitable as ever. Yeah. So will not yield to restraint when it conflicts with his desires. Again, prefrontal lobe is related to our ability to control our impulses, right? Part of the reason why we know that is because we know that when people have damage to their frontal lobe, they seem to exhibit problems with being able to delay their gratification, right? They see a candy bar and they want to eat the candy bar, and they will open up the wrapper and start eating the candy bar without paying for it. Yeah, that kind of thing. Yeah, they see what they want and they do it. Yeah. Another thing too, Gage's employers, who originally had very high marks for him, right? They had very positive things to say about him. But when they brought him back in and they tried to let him continue working, the quote is, his fitful, irreverent, indulging at times in the grossest profanity, which was not previously his custom, manifesting but little deference for his fellows, impatient of restraint or advice when it conflicts with his desires. A child of his intellectual capacity and manifestations, he has the animal passions of a strong mind, right? So, still got all the motivational aspects intact, right? Still capable of saying, I see that, I want that, yeah, and to go after it, but not able to sort of compromise and say, okay, well, I want that, but I can't afford to pay for it, or I want to kiss that girl, but she's, in a relationship with someone else, or that sort of thing, right? So he lost that kind of social ability to recognize that there are rules and there are norms and there are guidelines, right? Or, maybe he did recognize them, but he wasn't able to conform his behavior to it. Yeah. And so here's one of the first indicators, and remember too, at the time of Phineas Gage back in the 1800s, the majority of what we knew about neuroanatomy and such was coming out of areas like phrenology, which we're going to take a look at. And that's just this idea that if we have a bump on our skull, that means that the part of the brain underneath it is more developed than the other areas, right? So this was direct evidence that, hey, if we have an injury to this part of our brain, our behavior changes, and it doesn't change for the better. Yeah. But also amazing too, that he could have such a severe injury and yet regain almost all of his function, right? That's a huge positive thing to hear when you're working with someone else who has brain damage. Yeah. Okay, so let's get started with the big stuff. Yeah, the central nervous system, the brain. Overall, the two major hemispheres that we look at, we call that the telencephalon. Yeah, and so what we're looking at here is from the top down. We're looking at the top of someone's head. We're looking through their skull at their brain. On the left-hand side, in the left hemisphere, you see all those blue veins. Yeah, that's part of the meninges. Yeah, our brain is covered by several different layers of tissue and things that hold in, for example, the cerebrospinal fluid and that kind of thing. So on the right hemisphere, you see that with all the meninges taken off. So you don't see all the veins and arteries and all the other layers of stuff, right? You can just see the gyri and sulci and that sort of stuff. Yeah. So want to note that the grooves here, the dips in the brain, yeah, these are called gyri, and the ridges are called sulci. Yeah. And I don't think that's right. Okay, and so the brain, basically the two major hemispheres of the brain, we put those together and call that the telencephalon. Yeah. So the two major, we call these hemispheres, right? Are divided into left hemisphere and right hemisphere. And you can see some differences here. On the left-hand side, you'll see the cerebral veins and arteries that actually cover both sides of the brain, but on the right-hand side, they've been removed. Yeah. Our brain inside of our skull is covered by various tissues called meninges. Yeah. And some of those hold the cerebral veins and arteries, and that's called the arachnoid. There's a couple other things we don't need to worry about, but know that, when you see a brain where you're just seeing the gyri and sulci and that sort of thing, all that other stuff has been removed. Yeah, that's not what it actually looks like inside the skull. Inside the skull, it's got a whole bunch of layers of coverings, veins, arteries, all kinds of stuff going on. Yeah, but to make it easy on us, we're just going to talk about the look at it in terms of without the meninges. Yeah, we aren't going to worry about the meninges. Okay, so what's running down here in the center is called the longitudinal fissure. Yeah, and this divides the left hemisphere and the right hemisphere. Okay, there is a band of fiber that goes between the two that allows the two hemispheres to communicate. We'll take a look at that on the next slide. But what we care about here is the idea that we have these gyri and sulci. Okay, and let me see if I can pull up my pen here. Okay, so we can take a look here. There are, like you can see, this is a deep groove here in the brain. I don't know if you can follow that my red line there. Yeah. So that groove there is called a sulci, yeah, or a sulcus. Yeah, plural, it's sulci. And so, as you can see, we have many of these very, very deep grooves, right? And what this shows us is, again, that cerebral cortex is folded up like origami so that we can fit all that material into our tiny little brain. Yeah. So when we're talking about the different divisions, like for example, here you see the parietal lobe, right? And you see this major sulcus here. Yeah. This basically is what helps to divide the frontal lobe from the parietal lobe. Yeah, so we use the sulci as different sort of landmarks in order to divide the brain up into different lobes. Yeah, and so we'll talk about that when we talk about the different lobes and such. So we've got the fissures, which are the sulci, and we've got the ridges. Yeah, so what's outlined here. Yeah, is called the gyri. This part. Yeah. So the big lobe or the ridge part, right, is what we call the gyri, and that's just basically a bump. Erase that. It looks terrible. Okay. What else do we want to talk about? Well, left hemisphere and right hemisphere. Here's the tough part. Yeah. We've got what's called contralateral representation. Yeah. So for a lot of things, we've got basically the right hemisphere is controlling the left side of the body. The left hemisphere controls the right side of the body. And that's what contralateral representation of the brain means. Yeah, that means that when we're looking at the somatosensory cortex on the left-hand side of the brain, and you touch a probe to the arm part of the left-hand side of the brain, the person's going to report feeling a sensation on their right arm. Yeah, because again, left side controls the left side of the brain controls the right side of the body. Right side of the brain controls the left side of the body. Yeah. Another very common division in terms of function between these two hemispheres is we see the majority of language abilities being controlled or dominated by the left hemisphere of the brain. Yeah. We also see the majority of visual abilities being dominated, directed, controlled in general by the right hemisphere of the brain. Now, does that mean that we lose all ability if we lose one hemisphere of the brain? Well, we're probably gonna typically, unless it's done under surgical conditions, you're probably gonna die if you lose half of your hemisphere. But we sometimes people do have a hemispherectomy and actually have it removed. I believe your textbook has a case in there about it. So, but they're still able, for example, if the person loses their left hemisphere, they still have problems with language. But they're able to communicate and that sort of thing. Yeah, so it's not all or nothing. It's not black and white. But the majority of the functions are done by the left-hand side. Yeah, and that's one of the great things about the brain is what's called plasticity, right? Neuroplasticity, and that's the idea that parts of the brain can start doing other functions if the area of the brain that's responsible for that function is damaged. Yeah, not perfectly, obviously. but we have an amazing ability to regain function even if a part of the brain that used to be responsible for that function is no longer active. Yeah, it's dead, right? Okay, but remember the contralateral representation, remember the sulci and the gyri and that sort of thing. That's important. So what happens if we cut down through the center of this brain here? Okay, so this is a slice down through the brain, yeah? And there are some important things here to note. One of those is that remember that the brain is covered by the cerebral cortex, and that's the gray matter that forms the sulci and the gyri, yeah? So what is that gray matter composed of? That is the neuron somas, or the cell bodies of neurons, yeah? That's why it's gray matter, because that's the color of the somas. We've also got, as you can see, a lot of white matter inside the brain, right? Underneath that gray matter, yeah? The white matter is comprised of myelinated axons of neurons, yeah? So all those neurons in the gray matter project their axons, not all of them, it's not one for one, but they project their axons, myelinated axons, into different parts of the brain, right? And so we have communication throughout the brain. A couple of things to point out. Like I said, the cerebral cortex is that outer layer of gray matter in the brain. Cerebral cortex is what allows us to have higher functions, like reasoning, like learning, like, again, delaying of gratification, yeah, logic, all that kind of stuff, right? That's thanks to our cerebral cortex. Another thing to note is that, if you look, the hemispheres are really only connected by one band of fibers, and that's the corpus callosum, yeah? The corpus callosum are myelinated axons that stretch from the left hemisphere to the right hemisphere, and from the right hemisphere to the left hemisphere. Yeah, that's how our hemispheres can communicate. And there's some discussion about split brain patients in your text. There, I think, are some videos at the end of the chapter there that have people who are split brain, and like, for example, if you show a picture to one half of their brain, right? If you block one eye and say, for example, you shine it into the left eye, so the right brain's picking it up, right? The language, if they've got corpus callosum, they can't say what they've seen because the right brain can't communicate that image to the left brain. Yeah. So fascinating stuff there. We don't need to worry so much about the split brain stuff, but what's more important is that corpus callosum is what allows the two hemispheres to communicate, yeah? So why might someone be a split brain? Why might they actually go in and do this on purpose and cut that corpus callosum? Well, the number one reason for doing that is severe epilepsy. People who have extremely frequent and strong grand mal seizures, right? They can't drive. It's very hard to function, especially kids. If you're having several seizures a day, it can interfere with your development. It can interfere with your learning. You cannot develop, your language properly, all that kind of stuff. So one of the interesting things we're seeing now is the use of cannabinoids to reduce seizures, especially in children who have things like Dravet syndrome, severe epileptic seizures. Like they can have 20, 30, sometimes up to 100 a day. Yeah. And when you're having seizures, just one after the next, you cannot function. Yeah. You can't go to school. You can't, you're not going to be able to develop. So the good thing is we hope that people are going to be able to be treated with medicine rather than having to go through having that corpus callosum cut. Yeah. Okay, so let's talk a little bit about neuroanatomy nomenclature. Okay, this is an image from your textbook. Here we've got on the left-hand side, we have the various terms: the telencephalon, diencephalon, mesencephalon, metencephalon, and myencephalon. Yeah. We're not as so much worried about that. I'm not going to be asking you necessarily to distinguish between the telencephalon and the myencephalon, but you are going to want to know what they sort of refer to, right? So, for example, the telencephalon refers to just these structures here. Yeah, cerebral hemisphere, cerebral cortex, white matter, subcortical structures. Yeah. Now, we also have on the right-hand side, we have the terms forebrain, midbrain, and hindbrain. Yeah, and that's an easier separation, as you can see. So, whereas the telencephalon refers to just the cerebral hemispheres and such, when we're talking about the forebrain, we're talking about not just the cerebral hemispheres, but also the thalamus and hypothalamus. That's why there's a red box around both of those structures there, right? Or both of those boxes, the orange box and the green box, because you put those all together, the thalamus, hypothalamus, cerebral hemispheres, and that becomes the forebrain. Yeah. Other divisions. We'll talk about the midbrain and what's in the midbrain. I don't think your textbook talks as much about it, but there's some interesting stuff worth noting. We've got the brain stem, which is the basically the structure in between our telencephalon and our spinal cord. Yeah. So the brain stem is comprised of the thalamus and hypothalamus, the midbrain structures, and the pons and the medulla. Now, sometimes they also include the cerebellum in the brain stem. Yeah. But we're going to go with the way that your textbook has divided it out. Yeah. Okay. So why do we have all of these different terms? Well, one thing it's important to note: nomenclature refers to a naming system, right? So we have different naming systems, and the idea is, just like we can structure different parts of the car under different areas, right? So like we can talk about the drivetrain of a car, yeah, and so that would include necessarily things like the transmission, yeah. We can talk about the suspension of the car, right, and that includes all these different parts as well, right? And then we can also talk about I'm sorry, I'm not a super, really knowledgeable about mechanics, but, we can talk about a car that includes the drivetrain and the suspension, or in a way that includes the motor and the exhaust, right? All that kind of stuff. So it's just different ways of looking at it, different ways of connecting things together. Yeah. So it's important that you're able to identify what these different areas are. Yeah. So what the thalamus and hypothalamus does. Yeah. It's important that you're able to recognize that when we're talking about the forebrain, that includes the cerebral hemispheres and the thalamus and hypothalamus. Yeah. I'm going to try and keep us focused on the forebrain, midbrain, and hindbrain, but your textbook, I know, uses the telencephalon, diencephalon, and all that kind of stuff. So let's look at another image, and hopefully it'll help you sort of make sense of all of this. Okay, this is not in your textbook, and but it is valuable because this gives you a representation of the brain and a sense for when we're talking about, for example, the forebrain. What does that include? That includes the telencephalon and the diencephalon. Well, what does that mean? Well, look up here, the forebrain, diencephalon, thalamus and hypothalamus. Yeah. Telencephalon, cortex, limbic system, basal ganglia. Yeah. Okay, so that's an easier way to sort of get a sense for what are the specific structures in each one of these areas, right? So the midbrain, right, mesencephalon here, and this contains things like the substantia nigra and the reticular activating, not the reticular activating system, but we'll talk about the different things. Ventral tegmental area is in there. That's a really important part of the brain for motivation and reward and things like that. Yeah. Another thing to note is what we're looking at here is the brain that's made opaque, so we can see inside. Yeah. The spinal cord basically comes up, and this is the inside of the brain here, right? The brain is around these structures here, so we can't see these when you're looking at the outside of a brain. This is the center of the brain. Yeah. Important to note too, the hypothalamus, right? One of the things that the hypothalamus does is it routes our sensory information. The incoming sensory information from all of our senses except for one is routed through the hypothalamus. Yeah. Let's see if you can guess. Which sense do you think is not routed through the hypothalamus? Is it vision? Is it hearing? Is it taste? Is it touch? Is it smell? Yeah. It's smell. Yeah. Olfactory. The olfactory, we have an olfactory bulb. Yeah. And the information goes from the nose to the olfactory bulb and does not go through the hypothalamus. Everything else, vision, hearing, touch, all that other stuff goes through that hypothalamus. Yeah. Okay. Other stuff to talk about. We've got the hindbrain here. Yeah. And when we're talking about the hindbrain, the major two structures there are the medulla, yeah, which is down here, the medulla, and the cerebellum, which is the sac-like structure right there. Yeah. The pons is here right on top of the medulla. Yeah. Okay. And so what do each of these structures do? Well, the cerebellum is really important for our fine motor movements, right? So, for example, being able to use a stand-up paddleboard, yeah. First you have to learn, right? But once you learn how, let's say you take a month off, right, and you don't go paddleboarding for a month, your ability to hop back on your paddleboard and maintain your balance and paddle out to the waves and catch a wave and that sort of thing, that's in large part thanks to the cerebellum, right? Just like riding a bike, the ability to ride a bike is housed in that cerebellum. It helps us to coordinate these motor movements and also hold that sort of non-declarative memory, right? And when I say non-declarative, it means it's easier to ride a bike than it is to teach someone how to ride a bike, yeah, to tell them. And in part because the idea is the more, you need forward motion in order to have stability. If you aren't moving forward, you're not going to be able to maintain yourself on the two wheels on the bike, right? And it's hard to sort of explain that to people. It's much easier to show it, right? You understand it, but it's hard to sort of explain it. Yeah, that's where that cerebellum is so useful. And so medulla is a big part of our basic sort of survival system. Yeah. And let's take a look. Let's take a look at the next slide so we can talk about these things separately. Okay, so when we're talking about the diencephalon, we're talking about the forebrain, yeah, and that's the two aspects. The thalamus, which is considered the gatekeeper, right? The thalamus has the lateral geniculate nucleus in it, and in some parts is sort of considered the gateway for information that's coming in and going out. Yeah. Those of you who have heard, you might have heard of a book called The Doors of Perception, and that's by a guy named Aldous Huxley. Yeah. The rock group The Doors named themselves The Doors after this book, The Doors of Perception. And what Aldous Huxley is talking about was his theory that we have a gateway in our brain that keeps out most information, right? So that we aren't overwhelmed by all the sights and sounds and smells and touch and all that other stuff. Yeah, we're able to very well sort of keep all that stuff at bay. Yeah, we're able to focus our attention, focus what we want to think about. Yeah, and so Aldous Huxley was one of the early folks who was exposed to psychedelic drugs from I can't remember, from the guy who developed LSD. And his experience with LSD led him to think that what LSD does is it stops this gatekeeper from working. And it instead opens up our senses and it opens up our brain to all the incoming information, right? Rather than narrowing it down and acting as a gatekeeper, he said, he thought that the LSD basically overwhelms or in some way or another reduces the function of the thalamus. So now we're having so much information flood our brain that we have psychedelic experiences, right? So interesting, worthwhile to think about, yeah. Okay, so, and did I mention that the lateral geniculate nucleus, this is what is specific to visual information. It gets information from the optic nerves, sends those signals to the visual cortex, yeah. And the thalamus is also important for the limbic system, which is things like our emotion and valuing things and saliency and all that kind of stuff. Hypothalamus sits on top of the thalamus, yeah. And this is really, it's like a switchboard, yeah. Helps to relay all of our sensory information and such. It's also responsible for our endocrine system. Yeah, we have hormones, right? Like testosterone and estrogen and those sorts of things. So things like having a libido, having a drive where you want to reproduce and all that kind of stuff. That's thanks to our hormones, thanks to our endocrine system, which is regulated by the hypothalamus. Yeah. Remember also the hypothalamus is part of the limbic system as well. And the idea here is that our hypothalamus sort of helps to keep things from going too strong in one direction or the other, right? So we get angry, but we don't get so angry that we drive our car off a cliff. Yeah, that kind of stuff. So that's a diencephalon. Then we have the mesencephalon, which includes the midbrain, right? And the midbrain is important because it is it's filled with stuff that help us to process visual and auditory information. But also, we've got the substantia nigra and the ventral tegmental area. I don't think the textbook mentions these things. If you take my Psychology 405 class where we're talking about biological correlates of substance abuse, this is a very important part in the brain because it is part of the reward pathway. Yeah. And what does that mean, the reward pathway? It means that when we experience pleasure, when we experience, for example, when you study hard and you get, an A on your test, that feeling that you have of achievement, that sense that, wow, it really paid off. And I didn't know that if I could make an A or not, and I worked hard and I did it. And now I'm proud of myself, right? I'm proud of this A. This is something that I worked hard for. That is thanks to our midbrain. It's thanks to our reward system. We're getting dopamine released in parts of our brain that when that happens, we have a sense of well-being and we have a sense of achievement. Yeah. So that's one of the reasons why people use drugs, because they can activate that reward pathway without studying for their exam. Yeah. So if they don't, if that's also how that addiction forms, right? Because it's extremely gratifying to have this sense of reward and that everything's okay and that you did the right thing. Yeah. And if all it takes is another $50 to go buy another bag of cocaine and snort, another line of cocaine to have that experience, versus working hard and studying and delaying our gratification and not going out to have fun and, reading the books and listening to the dry lectures and all that other stuff, right? Much more enticing to want to just go snort the cocaine and feel good without having to do any of the stuff that activates that thing naturally. Yeah. So, but it's not just addiction, it's motivation. Yeah, our midbrain, the substantia nigra, the ventral tegmental area, those sorts of things help us to identify things that we like, that are good for us, that are related to our survival, and then to do the behaviors that we need to do in order to obtain those things. Okay? So it is the function of this motivation, this reward pathway, to get us to eat, right? When you eat, especially, there's a big difference, right, between, for most of us, eating a salad versus eating a delicious pizza or something real, indulgent or whatever, yeah. But the idea being that when you have that sense of indulgence, when that ice cream or that steak or whatever you're eating, you're going, oh, this is this is unreal, right? That's that reward pathway. And it's saying, this is important for your survival. You need to do this again. You need to remember this, yeah. And that's another part. This also connects to our hypothalamus, our hippocampus, which helps to set a memory and say, don't forget, that's where you got that delicious steak. You got to go back there and get that steak again as soon as possible, because that's related to your survival. Yeah. Okay. Then what else is in the mesencephalon? We've got the reticular formation and the brainstem. Yeah. And this again is structures that allow us to process visual and auditory info. Yeah. But also well, when we get into the hindbrain, we can talk about other stuff. So let's take a look at the hindbrain. Okay, so the hindbrain is divided into metencephalon and myencephalon, and basically, let's talk about the different structures here. In the metencephalon, we've got the pons and the cerebellum. Okay, and the metencephalon is important because, because the pons is important for processing our sensory and motor information, and it is sort of like a relay center, that helps the hypothalamus to divide up the information, send it where it needs to go, right? Also, and this again is not just sensory information coming in, but it's also motor information going out, right? Another aspect of the metencephalon is the cerebellum, and you remember that this is sometimes referred to as the little brain. Reason for that is because it kind of looks like a little brain, but it's we're learning more about it, and we know now that it's not just involved in our coordination and our muscle memory. It's been identified that it plays a role in different cognitive functions, things like our speech abilities, right, and that sort of thing. Another interesting fact about the cerebellum is the cerebellum contains more neurons than any other structure in the brain. So more neurons than the frontal lobe. Why is that? We're talking about muscle and motor movements. We're talking about coordination, but also, now we're finding out that there's a little bit of language in there. There's other higher cognitive functions in there. So we have a lot more to learn about the cerebellum, a lot more to understand. It used to be something that they would just briefly say the cerebellum allows you to ride a bike after a month or two where you haven't ridden a bike, and then they just move on. But it looks like we're going to be having a lot more to say about the cerebellum in the coming years, and that's a fascinating area of discovery there. Another part of the hindbrain is the myelencephalon, and that refers basically to the medulla oblongata by itself. Okay, the medulla oblongata. Any of you who have seen that Adam Sandler movie Waterboy, right? They talk about the medulla oblongata, and there's a thing in there where the Waterboy speaks kind of funny, and he gets made fun of for being kind of socially inept and for the way that he speaks and such. And there's a professor in there who says there must be something wrong with his medulla oblongata, right? And then I think the Waterboy tackles him or something like that. That's not the way that works. Your medulla oblongata is all involuntary function. So some of the interesting things about the medulla oblongata is that we have inside it, we have an area that is called the area postrema. And the area postrema is the one part in the brain that does not have the blood-brain barrier. There's one part in the brain, and that's in the medulla oblongata. It's a place called the area postrema, and it has absolutely no blood-brain barrier there. Can you think for a minute why that might be? Why would we have a part, especially in our brain stem, which is what's responsible for our respiration and our heart rate and all those autonomic functions? Well, another term for the area postrema is I'm trying to think of how do we put this in a non-grotesque way. It's basically the vomit center. Okay, so people who have drunk too much alcohol, and have this sort of really strong exuration of their stomach contents. This isn't just a normal sort of expelling, but it comes out in extremely strong, high volume, really powerful. The whole body sort of tenses up, right? When someone's throwing up like that, that's because their area postrema, had too much alcohol. Okay, so the blood-brain barrier does not exist in the area postrema, and that little area basically is that sensor, right? It says we've got too much of this poison in our system, and we need to eject as much of this poison as possible. So it has an almost automatic and direct effect going to the digestive tract and causing a very strong vomit, throwing up. Yeah. And this is linked to our survival, right? The idea being that this is the part of the brain that picks up whether or not we're being poisoned. Yeah. And you might think to yourself, well, wait a minute, alcohol, is a drug. It's not like cyanide or that sort of thing. Well, actually, no, it functions as a poison. The reason people feel experiences from alcohol is because it works to sedate. And, if you take enough of it, it sedates those parts of the body that are necessary for our basic survival, right? Alcohol works from the top down, so it works on our cerebral cortex first. That's why those first couple of drinks, right? You don't have the swerving, you don't have the slurred speech and that kind of thing. But what do you feel? You feel more social, right? And you feel like you don't really think so much about what you're about to say. You just kind of say it, yeah? Your inhibitions are lowered, right? And that's part of that cortex's job. So this sedation, basically, as you continue to drink, it works its way down. And when it gets down to the medulla oblongata, if it sedates those basic survival things, that's how people die from alcohol poisoning. Yeah, and that's why it's called alcohol poisoning. Yeah, you don't hear of alcohol overdose. It's a poison. Yeah. Okay, so medulla oblongata is very important for those things. Also important for things like digestion. Yeah, our ability to swallow, the sneezing. Yeah, all that stuff comes from the medulla oblongata. These are all autonomic functions. So which nervous system is that? That's the autonomic nervous system. Okay, let's take a look at the lobes of the brain. All right, and so here we have, I think this is from your text. I think you have this in your text. Yeah, I went ahead and added some detail to it. Let's take a look at the left-hand side on the frontal lobe in blue. Frontal lobe is in blue. This is where we have those higher conscious functions. Yeah, our ability for speech. Although we have an auditory cortex somewhere else, and we have the whole brain is responsible for speech, but our ability to communicate in an organized fashion comes from our frontal lobe. Yeah, our ability to do things like recognize. Let's say, for example, you're given a test. Yeah, somebody gives you a piece of wood that's 5 feet long, right? And they tell you that they want you to cut it into 5 equal lengths. Yeah, it's your frontal lobe that allows you to take a look at this thing and say, well, I better measure it, right? And then I need to figure out, what is equally divisible, because I need 5 equal pieces, right? If you don't have a good functioning frontal lobe, you're going to do what people who aren't able to reason very well would do, right? So someone says, I need 5 equal lengths from this 5-foot piece of wood, and they immediately saw that piece of wood in half. Yeah, well, now you've got 2.5-foot lengths, and you're not going to be able to make it into 5 1-foot long pieces of wood, right? That's what problem solving is about. That's what judgment is about. That's what planning and organization and all that other stuff. And that all comes from our frontal lobe. Yeah. So, when, next time when your kid asks for something and you ask them to be patient, right? That's their frontal lobe that you're asking them to function. Or the next time you ask somebody for something and they ask you to be patient, that's your frontal lobe. You want to develop that ability for patience. You want to develop that ability to delay your gratification. That's one of the things that makes the difference between successful people and unsuccessful people, is that those folks who are able to recognize that, yes, they want something and they want it badly. However, there are other priorities that are more important. Yeah. And that ability to say, I'm going to have that whatever I want. But first, I need to do those things that are going to get me to that point where I can have it and it's fair and it's legal and it's all okay. Yeah, I'm not just going to grab somebody's lychee from their tree and then run away, right? I'm going to go make friends with the person who has the lychee tree. I'm going to bring them some of my rambutan or whatever I'm growing, yeah, and see if I can get some trade. Yeah. Okay. Underneath let's work from the frontal lobe back. So frontal lobe, and then on the right hand side is the parietal lobe, right? Parietal lobe is divided from the frontal lobe thanks to our central sulcus, and we'll see that. We'll talk about that in the next lecture. Our parietal lobe is important for touch and taste because it has the somatosensory cortex on it. Yeah, and that's a strip basically. The gyrus right next to that central sulcus is our somatosensory cortex, right? So we've got our body actually outlaid or represented on that one strip of brain tissue. Yeah, our hands, our feet, our neck, our eyes, our stomach, and especially our face. Yeah. And the parts that have more nerve endings are represented in larger sections of that brain tissue. Yeah. So we have larger sections for our lips, for example, than we do for our feet. Yeah. So that's the parietal lobe. Also in the parietal lobe are association areas. Yeah. And at the bottom of the somatosensory cortex, by the way, is what's called the gustatory cortex, and that's what allows us to experience taste. Yeah. Okay, so parietal lobe. Then let's go to the very back of the brain in the occipital lobe. The occipital lobe, the number one thing that it does is vision. It contains our visual cortex, and the association areas, right, that allow us to make sense of what we're seeing. So our ability to track motion, our ability to recognize that what we're seeing, when we see a bunch of lines and a bunch of numbers that are arranged in a circle, and there's one sort of short line and one longer line in the center there, we can understand, so this is a clock face, yeah, an analog clock face. So the top is a 12, and then 1, 2, 3, and it goes around in a circle up to 11, and then 12, and then starts over again. That's that occipital lobe. Yeah, it allows us to recognize collective features, right? One of the most important things we do with that is the recognition of faces. Yeah, this is one of the things that separates human beings from artificial intelligence. Yeah, they're getting better at it, but our brain is amazingly superior at recognizing faces, at identifying facial features of people that we've seen before. Yeah, we are light years ahead of the artificial intelligence that does the same thing. Yeah, and that's one of the bridges that neuroscientists and computer scientists are trying to make, is finding out what the brain does well, how it does it, so that we can figure out how to make a machine to do it as well. Yeah. Okay. I'm going to skip the cerebellum real quick because that's not a lobe of the brain. Move over here to the temporal lobe in green. This temporal lobe sort of looks like, if you think of the brain as kind of like a boxing glove, yeah, that temporal lobe is sort of the thumb. Yeah, you see that, how it sort of sticks out? In our temporal lobe, we have our olfactory cortex, which means that the olfactory bulb, when we smell something, yeah, that information is being interpreted in our temporal lobe. We also have our auditory cortex, and it's actually very close to the occipital lobe as well, the auditory cortex, and we'll take a look at that in the next lecture. So our ability for language, our ability to process what we hear into language, right, and understand that someone, this person is speaking, but they're speaking a language that I don't speak, right, that kind of thing. So auditory processing, as well as things like memory, the integration of various senses and that sort of thing, all important for our temporal lobe. Yeah. And then finally, just real quick, this was the best chance that I had to sort of say, here's where the cerebellum is, and this is what it looks like. Yeah. You're going to have a video in the next lecture that'll show you the cerebellum and that kind of thing. But I just wanted to include it because I didn't have any other images where I was pointing out specifically the cerebellum itself. Yeah. Okay, so the cerebellum sits underneath the occipital lobe and the temporal lobe, right? And it's attached basically to that brain stem. Yeah. Okay, so we've talked about the various things that the different lobes of the brain does. Yeah. So now we can do a quick quiz where this is a way to sort of recognize or to help yourself memorize what these lobes of the brain do. So the first thing, realizing that the delicious smelling bread you're baking is nearly done. Yeah. So what is that? That's your nose, right? Your nose is going to tell you that. So that's what? Olfactory. Where's the olfactory cortex in? Which lobe of the brain is it in? I'm going to give you a minute before I tell you what it is. I'm only going to tell you verbally. Yeah. So you might want to write it down or that sort of thing. Okay. All right. So for number one, the lobe of the brain that helps you to realize that the delicious smelling bread you're baking is nearly done is the temporal lobe. Yeah, like that thumb from the boxing glove. Yeah, because that has that olfactory bulb in it, that olfactory cortex. Okay. What lobe of the brain is responsible for our ability to understand that the buttons in the digital display on our car dashboard go together to form a radio, right? The ability to look at our car dashboard and say, that's the on-off switch, that's the volume switch, that's my preset, radio station buttons. Yeah, this is where the CD goes. Or back when I used to, we used to have audio cassettes, and even before that, we had 8 tracks. If you want to go back in time. Yeah. So our ability, the brain lobe that allows us to sort of put all those things together, right? It's the same one that allows us to see things like on an analog clock face, right? Yeah. So being able to recognize the facial features or recognize that things go together in a collective way, right? That is our occipital lobe, right? Remember that back lobe where our visual cortex is, okay? All right, the third one, buying refreshments, decorating your house for an upcoming party. Yeah. Okay, so what are we talking about here? When we're talking about buying refreshments, you're thinking how many people are going to come and what kind of party are we having, right? Because we're going to have a different party for July 4th than we would for Halloween. Yeah. So we got to buy refreshments. We got to decorate our house, right? And, again, is this a Halloween party? Well, then we got to put up the cobwebs and the black cats and the skulls and the witches and all that other stuff. If it's a 4th of July party, then we got to put out the flags and the red, white, and blue and get our all our fireworks together and all that good stuff. Yeah. So what are we doing here? We're planning things, right? We're organizing. We're making judgments. We're making determinations. Yeah. So all of this stuff is what our frontal lobe does. Yeah. It allows us to say, okay, I'm going to have 20 people coming. So if I only buy one package of hot dogs, there's going to be some pretty disappointed people. Yeah. All that stuff is our frontal lobe being able to figure that stuff out. Okay. All right. Number 4, which lobe of the brain helps us to recognize when a friend is throwing a water balloon at us and to duck real quick when it's coming? Yeah. Well, this is a little bit of a double question, right? So when we see the water balloon coming at us, what part of the brain is that? What part of the brain has that visual cortex? That's the occipital lobe again. Yeah. To see, oh, hey, he's got the water balloon and he's aiming it at me, right? Now the ducking part, right? That's an automatic sort of function. We don't think to ourselves, duck. We just automatically duck. Yeah. So that's a different aspect. We're talking about the autonomic nervous system, right? We're talking about the sympathetic nervous system that gives us energy to respond quickly. Yeah. Okay. And then number 5 is asking you which lobe of the brain is responsible for feeling pain when somebody pinches you. Yeah. And we're not talking about just feeling pain, but specifically feeling pain because somebody pinched your arm. Yeah. Okay. So it's a part of the brain that is responsible for our senses, right? Incoming senses. And which part of the brain is that? Which part of the brain has that somatosensory cortex? Yeah. I'm going to tell you. It is the parietal lobe. Yeah. Parietal lobe has the somatosensory cortex, and that's what's going to be activated when somebody pinches you. Okay. If some of this doesn't make sense to you, if you have any questions about this, please let me know because I'm happy to explain it in greater detail if you need. Okay? right, that'll do it for the second part of this lecture. In the final lecture, we're going to be looking at brain structures and functions in more detail. We're going to talk about studying the nervous system and neuroimaging. Yeah. You're also going to have it's not written on the slide, but there's going to be a demonstration, a neuroanatomy demonstration. And then brain manipulation techniques. We'll talk about those as well. Okay. Also wanted to mention the other stuff that you have to do this week. You've got your discussion topic, and because there's a reaction paper due this week, it's a fairly straightforward, easy discussion topic. Just make sure that it's 150 words and that you give a complete answer. Yeah. So there's 3 questions written on the discussion board for discussion 2, and you choose one of those that is most interesting to you and write your response to it on the discussion board by Friday. Okay. Also, this week is your reaction paper 1, and that's based on the film What is Reality? It's a series with David Eagleman. Yeah. So you're going to watch this film. The link is in the syllabus textbook and lectures page in reaction paper films. I think I also posted it on the assignments page as well. And I think the link is also on the syllabus. Yeah. So, but it's basically a YouTube video. I think it's about 50 minutes long or so. You watch that video and then develop your reaction paper to it. Then we've also got quiz 2 this Friday. Yeah. So a lot of stuff happening. And if you have any questions about any of these assignments or anything like that, please don't hesitate to contact me. Okay. All right. Until the last lecture in this series. And, until I speak to you over the phone or we communicate some other way, a hui ho.